Mary is the Orthopedic Service Line Administrator for a major healthcare organization. Right now, she's fighting a headache. With public and private payers moving toward bundled payments and value-based care models, her leadership is facing more challenges, and so is Mary. She's now under pressure to manage the quality outcomes and costs for a full 120 days of pre- and post-operative care for her patients, not only the surgical event itself. The joint replacement population is the key focus for the moment, but new populations are sure to follow. Getting the right process in place is proving very difficult. It's always been a priority to prep patients well for surgery, but getting on the same page with surgeons and patients about the optimal recovery plan isn't so easy. Mary knows this coordination is extremely important if she's going to keep costs under control and reduce unfavorable outcomes like complications and readmissions, not to mention gaining more credibility with her surgeons. Low-risk patients keep getting sent to expensive skilled nursing facilities, and moderate and high-risk patients continue to be readmitted with complications at an unacceptable rate. She's hired nurses as care navigators, but doesn't have a consistent standard for optimizing the different patient groups through their post-surgical journey. At the moment, she and her team are relying on a very manual process, entering patient data into a spreadsheet, communicating by voicemail and text, and spending a lot of valuable time trying to figure out which patient needs attention in the moment. She knows it's not going to work for long unless she hires even more staff to navigate the patients. And while she intuitively knows how to navigate patient episodes, without the needed quality and financial analytics to let her know how and where to improve, she can't predict and measure performance accurately. One afternoon, as Mary is getting a rare lunch break, she stumbles across an interesting article. It profiles one of the country's largest orthopedic practices that's taking a new approach to managing episodes of care as they address bundled payment opportunities. The focus is on improving post-acute outcomes and costs. Partnering with Locus Health, they implemented a software platform blending both analytics and navigation workflow management to help the practice successfully manage their surgical populations with significantly less staff than anticipated. Mary's already been approached by several software companies. They did an in-depth analysis of her historical data. They identified where costs are managed poorly, but didn't have a lot to say about how to support the clinical side of the equation, nor how to engage patients more actively at key points in the episode. And ultimately, their limited tools ended up on the shelf. As she reads the article further, she's surprised to find out that Locus Health provided a tailored, comprehensive solution. A customizable platform that could connect real-time data and analytics with care navigation. Curious, Mary gives Locus Health a call. She's worried that she's going to have to start from scratch with a whole new system, but after some brainstorming with the Locus Health team, she learns otherwise. They show her how to more effectively use the tools and personnel she's already invested in while building a more cohesive and data-driven system. With their experience and collaborative design approach, Locus Health is able to steer Mary around pitfalls before she even gets to them. The Locus Health implementation team joins her on site to share their blue-collar experience and work with her to build a solution that seamlessly fits within her team's workflow, an approach that she hadn't previously experienced. When the surgeons in the orthopedic service line start using the data, comparing performance results, and going so far as to ask Mary for even more reporting on a regular basis, she knows she succeeded in producing healthy patients and happy physicians. If you're curious about how you can get your team on board with successful bundled payment strategies and achieve better patient outcomes, contact Locus Health to learn more.